Hi, I'm Beverly Butler. I'm here to give you a short speech about the dangers of hydrocodone addiction and the recent legislation that has taken place to counteract and fight this type of addiction. So imagine you wake up in the middle of the night with stabbing abdominal pain. This might have happened to some of you. You go to the emergency room, and a few hours later, you're discharged home minus one very inflamed vestigial organ. You've had a quick appendectomy, and in the past, your physician might have given you a prescription for a hydrocodone-based pain reliever. But since October of 2014, that's probably not the case. You're more likely to be told to go home and take Tylenol or ibuprofen for the incisional pain you might have afterwards. Um, the reason this has happened shows a basic shift in the way we're dealing with a rampant problem of hydrocodone drug abuse and prescription drug abuse and addiction. Few of us are lucky enough to go through an entire life and not need some sort of pain medication for moderate or severe pain. And until recently, doctors had free reign. They could just write you a quick prescription for Norco or Lortab or Vicodin and send you on your way. But after as short a time as 5 days of taking this medication, you become physically and even psychologically dependent on it. So recent changes have taken place as of October 2014 addressing the prescription drug abuse. They've increased the reporting requirements for physicians, and this can directly affect your health and welfare. Our panel of speakers includes 2 nurses and a law enforcement officer. We hope to inform you of the problem prescription drug addiction from an experienced medical and legal point of view. So for many years, hydrocodone in the form of tablets compounded with aspirin, acetaminophen, or ibuprofen have been the go-to prescription relied on many doctors to control their patients' moderate to severe pain. Unfortunately, this has led to many people becoming addicted to this opiate pain reliever. Recent legislation has addressed the overprescription of these medications by reclassifying them to a Class II drug and requiring more documentation and increased reporting by physicians. So doctors have quit prescribing them so much because it's a lot more inconvenient for them. We'll examine the problem and solution through the mechanics of opiate addiction, new medical prescriptive legislation, and forensic enforcement of the new laws. So not only has overprescription of hydrocodone led to drug abuse, but a thriving black market has developed around this drug. So what's caused hydrocodone to be one of the most abused prescription medications of this age? Hydrocodone belongs to a class of medications known as opiates. It's a semi-synthetic derivative of codeine. And according to researcher Thyarapa Praveen and colleagues, in their 2011 article titled Opiate Dependence, opiate use can lead to physical and psychological dependence within as short a time as 5 days. When this dependence leads to behavioral and lifestyle changes centering on obtaining and using these drugs, to the exclusion of other previously desired behaviors, hanging out with your family, keeping your job, and things of that nature, it's termed an addiction, and it can be very difficult to treat. According to Praveen, physical dependence occurs after a few weeks of consistently taking these narcotics. Christina K. Slow writes in her 2012 article, Opiate Withdrawal, that soon after stopping narcotics, symptoms such as muscle aches, restlessness, anxiety, tearing eyes, runny nose, and excessive sweating occur. This can take place within 24 hours of stopping this medication if you're used to taking it. If the withdrawal continues for more than about a day, more intense symptoms occur. These include diarrhea, muscle cramps, abdominal cramping, nausea, vomiting, dilated pupils, rapid heartbeat, and high blood pressure. This is very unpleasant, can be painful. The physical withdrawal symptoms usually begin to improve in about 72 hours, and they're usually gone in about a week. But many people are left with an intense psychological craving for this medication. Writer Case Lowe reports that the pleasure centers in the brain are directly affected by the opiates, such as hydrocodone, and users quickly develop an addiction to the sense of well-being and the euphoria that occurs with these drugs, to the exclusion that nothing else is going to meet that need. And so this becomes a long-term dependency, very high rate of relapse. Many times, patients or addicts have to be treated with a substitution therapy. Methadone is one of the main ones, and through the use of methadone, which suppresses the craving for the medication, they can achieve long-term sobriety and prevent relapse. Praveen further states that social support and 12-step programs may be necessary to completely recover from the addiction. So how has the legislation changed to prevent this black market saturation and a large percentage of the population becoming addicted to hydrocodone? I take this opportunity to introduce you to my colleague and classmate, Heidi Cooper, who will explain current legislative changes and efforts to prevent and control this ever-growing problem. Thank you. 3 minutes? How much? That's not going to work.